So breast reduction, again, it's one of my favorite surgeries because patients really get both a physical benefit as well as a cosmetic benefit. Bottom line is you want to make the breasts smaller, shapelier, perkier, and shift them higher up on the patient's chest. And how small you want to leave the breast depends on the patient's goals. So some people want to have larger breasts at the end of surgery, and some people want to have smaller breasts. Some people say, they come in and say, just take them off, I don't even want them anymore. Of course, we never do that. And other people say, well, I want them to be mostly lifted with just a little bit smaller, but not a lot smaller. So basically, when it comes to the patients, I just take a look at the breasts, I discuss with them what they want, what their goals are, and we discuss what we're shooting for as a final result. My patients tell me after the surgery it's one of the best things they've ever done for themselves. And most of them, if they were older when they had the surgery, they say, I wish I'd done this 10, 20, whatever number of years ago. I don't know how I've lived my whole life like this. But the benefits they feel are physical. They feel a lightness. It's like having, I always tell patients, it's like you've been wearing a backpack your whole life. You could never take it off, and here it is. We took the backpack off. All of a sudden you have this feeling of lightness, of health. Your breasts aren't hanging over your stomach anymore, so it's going to elongate the torso. It makes you look better. It makes you look less matronly, more athletic. And that shoulder grooving and the trouble finding bras that fit and finding dresses that fit, these patients are really very unhappy with the situation. And when they can finally see themselves in new clothes, they don't have to go special order bras anymore online. They can just walk into any Victoria's Secrets and buy a bra. It's a real life changer for these patients. And I really, it makes me happy when I see them. They're the patients probably giving me the most hugs after surgery.